you. Well, some teenagers are now turning to plastic surgery as a way to help them with bullying. Dr. Jennifer Walden and Austin Child Guidance Center's Seanna Crosbie are with us to talk about why kids maybe see this as their best option and maybe if there are any risks. Good to see you both. Thanks so much for being with us. Now, Dr. Walden, you were just telling me about how there's been a rise in kids getting plastic surgery. What have you seen over the years?
In the past decade, there's been about a 30% increase in teenage and young children getting plastic surgery procedures to affect their cosmetic appearance.
Okay, so which type of procedures are we seeing typically?
We're talking about otoplasty or ear pinning for people who have prominent ears, nose surgery, we call it rhinoplasty for a hooked or crooked nose, male breast reduction for young men who have enlargement during their teenage years. All of those things are good indications for a cosmetic procedure to help their distress and depression related to that.
Okay, so Seanna, have you seen that? Are there a lot of kids who complain about that and say, yeah, I'm getting teased and I'm going to do something about it?
So yeah, kids are teased really for a variety of reasons.
Yeah.
For example, I had a client who I saw over the summer who was overweight and teased because he was overweight. What we know about bullying is that it's a systems issue. It's not necessarily an issue just with the victim, but there is a dynamic that is involved with the perpetrator of bullying, as well as how the community and the schools manage bullying.
Sure. So do you see plastic surgery as an effective, I guess, I don't want to say cure, but as an effective way to get through bullying?
So I think it's a personal option that every parent really has to weigh, you know, if it's an option for their child. What I have seen in my practice in dealing with bullying is that it requires a multi-pronged approach, and that is it requires intervention with the individual being bullied, because they do often, as Dr. Walden said, they do suffer from depression and anxiety.
Yes.
Bullies also typically suffer from their own mental health issues as well, and it also requires intervention by the schools. Research shows that the best way to address bullying is to create more supervision in schools, to train teachers how to address bullying in schools. And the biggest impact on bullying that anyone is going to have is to train bystanders, the kids who are around the bullying at the time that it's happening, and on ways to intervene and to support the kid who is being bullied.
I want to go back to the kids who might feel, you know, you were talking about this, Dr. Walden, the depression and anxiety, and really getting to a point where they feel like they don't have any more options. And maybe in those cases, that is the right thing to do, right?
Right, and it has to be, like Seanna is saying, multi-pronged. It has to be a decision among a relatively mature child or teenager, their parent, a clinical psychologist or social worker, and the surgeon. Everybody has to be on the same page that this might not alleviate every single problem in their life, but this can address a real pinpoint issue of if they've been called Dumbo for the last 5 years.
Right. Yeah, I mean, you want to address the self-confidence part of it, and maybe aside from bullying, look at that child. You know, is this affecting their daily life? I mean, is it, you know, they're just constantly focused on, oh, their ears are too big or their nose is too big or whatever, and then that's when maybe you talk to a doctor.
Exactly. I mean, I think the improvement in self-esteem and self-confidence that a 2-hour procedure can make can be very life-changing, and that's where this can be a positive for children and teenagers. It's when they are obsessed about their nose and their ears, and there is a real physical defect that they're getting teased about.
Now, have you done these surgeries, and have you done post-op, and they've said, oh my gosh, this changed my life?
Absolutely. Did an otoplasty just this week, and it's a life-changing procedure, like I said, and a lot of teenagers and men in their young 20s and 30s say, why didn't I just get this sooner? It was really easier than I thought.
Interesting. But obviously you want to meet with a doctor, meet maybe with a counselor to see what's going on before you make such a decision.
Definitely. At the Austin Child Guidance Center, we provide parent workshops and trainings for school personnel and other child-serving agencies. So I would certainly recommend, you know, consulting your physician, but also consulting a mental health professional before making that decision.
Now, these procedures, Dr. Walden, like a nose or ears or like breast reduction, like for boys, are there any big risks? I mean, obviously you got general anesthesia, which is always a risk, but other than that?
Well, as long as the child is fit and healthy and has been cleared by their pediatrician for surgery, it's the risks that are inherent in a surgical procedure, which is elective, and that is the risk of general anesthesia, of a wound infection, something like that, a bleeding complication, and those are relatively rare in the big scheme of things as long as we're controlling for all of the other factors, and they go to a board-certified plastic surgeon, and this is being done in an accredited facility and that sort of thing.
Right. All right. Good information. Thank you so much for being here. We appreciate it.